Please note that at this time, our health unit staff will continue to follow up with you directly to provide your results. With the number of tests pending, results may take up to 4 days. Once you have received your results, you will also be given instructions as to next steps. Please remember that while you are awaiting your results, you must remain in self-isolation. Overall, 4,324 individuals have been tested for COVID-19, and of those tested, 557 tests are pending. I will now share the most current case counts. There are 36,831 confirmed cases of COVID-19 in Canada and 11,184 cases in Ontario. Chatham-Kent has 31 cases, and Sarnia-Lambton has reported 148 cases. Michigan now has 32,000 cases, with 7,736 cases being in Detroit. Today, we are reporting 506 cases of COVID-19 in our community, an increase of 24 cases from yesterday. 41% of all cases are in long-term care and retirement homes. 88 cases have been resolved. 18% are between the ages of 50 and 59 years, and 23% of our cases are 80 years and older. 39% are male, 60% are female, and 1% are unknown at this time. Our community has lost a total of 31 people to COVID. 22 deaths have occurred among residents in long-term care and retirement homes. Our health unit continues to work with 6 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Symptoms of COVID-19 include fever, cough, difficulty breathing. However, other symptoms may present, such as being extremely tired, falling, having nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, complete the online self-assessment tool, or contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. Windsor-Essex now has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. These include healthcare workers, caregivers, care providers, first responders, residents and staff of long-term care homes and retirement homes, and residents in the community referred by testing by their health unit or the primary care provider. Please continue to visit WECHU.org for the most current information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. As we are reporting for 24 additional cases and 4 additional deaths in our community. 2 males in their 90s, 1 male in his 60s, and 1 male in his 40s passed away yesterday. Any life lost to COVID, it's a huge burden on all of us in our community, and we all need to do everything to prevent these losses from happening in the first place. All the individuals that passed away were positive for COVID-19. The 2 gentlemen in their 90s were resident in a long-term care facility. And we are currently monitoring 6 long-term care homes and retirement homes in our community for COVID outbreak. The facilities that are currently under COVID-19 outbreak is Amica, Sun Parlor, Lifetimes on Riverside, Franklin Gardens, Heron Terrace, and Country Village Home. The WECHU has removed Extended Care Southwood Lakes from COVID-19 outbreak this morning, as they met the case definition. The definition to come out of the outbreak case definition. A COVID-19 outbreak in long-term care home is considered resolved when there are no new cases in the staff or residents for 14 days from the last case being placed in isolation. Since its first reported outbreak on April 1st, WECHU has removed 3 facilities from Outbreak. For information regarding our outbreak, please visit our website for further details. As announced yesterday, the WECHU is proud to team up with our local primary care partners and hospitals to launch the COVID-19 Population Health Navigator. The Navigator tool, which will be live for today and can be accessed through our website or going directly to ehealthwindsor-essex.ca.
We'll now take questions from the media. We'll start with CBC.
Good morning. You said a man in his 40s had died. Is that the youngest person so far from Windsor-Essex?
That is correct.
Is the virtual walk-in a way to? What is the best use of the virtual walk-in? Is this a way to not call the nurse's line? Is this a way to not call your local doctor? Is this a way to kind of streamline? Yeah, so the idea of the virtual walk-in clinic is to provide a service to people who might otherwise have attended a walk-in clinic in person but are not able to do so currently. So we would most definitely encourage people who have a family doctor or a nurse practitioner to try and connect with them first, whether on the phone or by video visit. And if their provider is not available for any reason, then the virtual walk-in clinic would be, they just have to go to the ehealthwindsor-essex.ca website, and then they can log into the virtual walk-in clinic to be directly connected with a provider. And as for long-term care, I know the here in Terrace still says that there's an outbreak. Having the people with COVID in a field hospital, are you still considering an outbreak until all those people's cases are resolved?
Well, the homes will be in outbreak until the last person who was there, either the case or an exposure, they pass that 14 days mark. So their homes will still be in outbreak until we get to the 14 days mark, where there is no new case in the facility, either in the resident or at the staff at the home. Like a field hospital, that's different. So we're talking about just the home. If there is no new case in the resident or the staff for 14 days, we will consider that that outbreak is over in that facility.
Thank you.
We'll now take questions from Blackburn.
Actually, I'm good.
Okay. Any questions from CTV?
I'm just curious what it takes to get rapid access testing. I saw in Detroit they have more drive-through testing with the Abbott ID now. What does it take to have that here?
So we did hear from Health Canada that they have approved a rapid test, but it is not rolled out currently from the government machinery at this time. And also we have reached out to the Public Health Ontario lab to get some details on whether, like, what do we do with this test if someone is coming back even and saying, I was tested using this? Should we accept it as a positive or a negative? We didn't get any information from them. They said that they are actively looking for it, and not just Ontario. Other provinces are also looking at it. They're doing some kind of a validation testing, which is important because we don't want to be in a situation where we are misdiagnosing someone or getting a false negative or a false positive. It would lead to more problems. So as much as I want those rapid test kits to be available, I want to make sure that it is reliable as a mechanism to test someone. As soon as we get the go-ahead from the province and the Public Health Ontario lab, we will be asking that, if you have the access, do it. And we are also asking the government too, would they be making it available for public health units or the hospitals to use that, or would it be in the private sector domain? So we don't know all those details, but we will share those details as soon as it's available.
Any questions from the Windsor Star?
Yes, we're hearing from people with gardening season approaching that they want to buy seeds and plants, and we're just wondering, are any garden centers going to be allowed to open?
That is a question that I think we'll have to check with our with the ministry too. Good question. I don't have an answer, but we can follow up and try and get some answers. As we know, even from the ministry announcement yesterday, that there has been some signs of seeing that the cases are peaking in the province. And there may be some phased approach to loosening the restrictions. So I don't know if that is being considered at this time, but something that we can definitely follow up.
And then at the Southwest Detention Center, the ministry continues to say that nobody has tested positive among inmates or staff. Do you know if inmates or staff have been tested? Are they being tested?
Well, the facility themselves, they are, because it's a facility, they do the testing. They have their own health team. If they are testing anyone, we get the results. If they are testing anyone who's coming back positive, we will get the results, and then we will action on it based on our guidance. As of now, we don't have any confirmed case in the facility, and if it happens, all public health actions will be taken.
Have people been tested there?
Well, people have been tested everywhere. It's not just one facility or one center.
Okay.
Everywhere, each facility, congregate setting, different types. People are being tested everywhere.
Okay, and then otherwise, we're just hearing from family members of inmates who are quite concerned about their loved ones getting sick. Do they have a right to be super concerned about that?
Well, this is a time when we know that COVID-19 is spread in many places, institutions, and they have all these measures in place to early detect cases. They are doing extra physical distancing measures to protect everyone. And this is not an area that we are critically involved in all the time, but we do know that there are measures in place and that are being taken to prevent this from happening in the first place. Early diagnose people if there is any symptomatic person, and then take appropriate action.
Thank you.
Any questions from AM 800?
Yeah, did you say, Dr. Ahmed, that all of the new deaths were all men?
That is correct. 2 male in 90s. Yeah.
Okay, so 2 male in the 90s, 1 in his 60s, 1 in his 40s?
Yep.
Okay, so the man in his 40s, obviously the youngest we've had and quite young when it comes to COVID-19. Were there any pre-existing conditions, do you know, that led to the death?
So what we know is the person had high blood pressure and was an excess smoker. That's all I can say. Other than that, there was nothing else that predisposed him to any other health condition, and that is why it is sad, and I think it's a life lost, which makes us all wonder that COVID-19 doesn't differentiate between gender, age. It can affect anyone. It can kill anyone, and all of us have a role to play in doing our best to prevent and limit the spread of the infection, and also not only for just ourselves, even for our loved ones. If we are not taking appropriate precautions, we are putting them at risk. We are putting our community at risk. So this is a reminder for everyone that no one should be thinking that it's not me, nothing will happen to me. It can happen to anyone and everyone.
Okay, and the person in their 60s as well, still a relatively young age compared to a lot of the deaths we've been seeing. Same question, were there any pre-existing conditions there that led to the death?
Not a lot of pre-existing conditions. I think it's the information that we have. It doesn't point us any details with respect to the health condition or pre-existing condition. We will do our epi summary again this Friday, and if there is anything that we can bring forward, we will bring forward.
Okay, thank you.
Any questions from Windsor?
Just a question about the virtual walk-in clinic. Is that something that's planned to continue after the COVID-19 outbreak, as though it's going to be sort of a new form of walk-in clinic accessibility?
I don't think that's been discussed today. We don't have a plan in place to continue it after the fact. That being said, virtual care is certainly something that I think is becoming increasingly popular. I think it's something that community members would like to see more of, and so I don't think the option is off the table.
Yeah, and if I can comment on it, obviously these virtual cares are more important in communities where there's a barrier for actually visiting the clinic and getting access to a healthcare provider. And these virtual visits do not replace the need for an in-person assessment. I think a clinician assessment in person is very important to ensure that the physician has the opportunity to go through a detailed physical assessment, which is important. Sometimes people don't even show any symptoms, but on their physical examination, they could show something different. So it's not to replace that. I think it's just there to complement that and making sure that people have all kinds of options available. And as Dr. Bondi said, that that's a good question. I don't know the future of it, but I anticipate that it will still exist in some shape or form, but we don't know that how useful it is and how it will replace everything else.
Any further questions from CBC?
No, thank you.
Blackburn?
No.
CTV?
I'm just curious if we know the youngest person tested or how young we have tested when it comes to children.
I believe we tested some pediatric population as well. I don't have the exact age, but I want to say maybe in their under 10 as well that were tested, but this is the one that we have seen the fatality, and which is a concern for all of us.